lip lifts. We talk a lot about them. We see them a lot in Instagram and social media. So what are they? Hi, I'm Rod Rohrich, helping make you a better you. Welcome to this podcast, Rohrich Knose podcast. And our goal is to help educate you about all aspects of not only aesthetic surgery, but also to help educate you about what will help make you better. So I am really pleased tonight to have actually one of my great patients who's had a lip lift, and she used to work for me as well in Dallas, and she's from West Texas. So Jana, welcome.
Hi, thank you, Dr. Rohrich. It's nice to be here, and I will try to curb my Texas accent just a bit. Now that I'm a Coloradoan,
Oh, you're Coloradoan?
Yes.
I don't. You know what?
I
One
love
thing
it.
is, you can leave Texas, but Texas can't leave you. Just remember that.
Okay,
And you
and
can
I
tell.
do.
Don't you love her accent? I love it. I don't have a Texas accent, but I sure can do it if I need to. But no, it's great. Anyway, Jana, so how are you?
Doing great.
Good. And
Yes.
I know it's winter in Texas, and because whenever it gets below 70 degrees, everybody puts on a coat. So it's good.
Yes.
I know. And it's actually a lot colder than that here in Big D. So we talk a lot about aging and how to correct it and things that make people look younger. And so tell me about why you approached me about having a lip lift. And, because we've done neuromodulator, we've done Botox and some fillers. And
Yes.
So what was it that bothered you about your lip?
Well,
She has a beautiful lip now.
I do have a beautiful lip now.
Yeah, you can see it. Look, you can see this. This is her before and her after. And she has a beautiful lip. You can tell because before you couldn't see her teeth, upper teeth. Now she has a nice glow. And when she animates.
I do. And I guess it started when I was a young girl. I had an older sister, about 13 months, and she had a very short space from her nose to her upper lip, and I always loved that about her. She's a very pretty woman, even at her age 64, and I am now 60, can I say just plus? I don't want
60
anybody.
plus?
60 plus a little. But I'm the younger sister by a few months, and 13 to be exact. And I always just noticed the beautiful people had this different look about them. And mine, I have a long oval face.
Yeah.
And that just made me look draggy, long, and that saying in Texas, long in the tooth. Well, that's what happens to your upper lip as you age. It just gets worse. And so I did my research about you, and the most important thing I read about lip lifts was you want to get someone who knows about noses, and that was you. It said find someone that knows about rhinoplasties, because that area under your nose, it's very important. You can get lopsided. I've seen some really ugly ones, and so when I found you for my Botox and filler, I wanted to get to know you first before, I could trust you to do that. Yes.
Yeah. No, I think you make a good point, Jana, because, it is a very delicate incision that's put in the waviness right below the lip and alar base junction. And so if you don't get that perfectly aligned, that can be a bad scar because it's in the center part of your face.
Right.
And so, in fact, I did a lip lift today in a secondary rhinoplasty patient, and she looks awesome. But
cool.
Usually I don't do the rhinoplasty with the lip lift. This was a different patient because she didn't need alar bases. But so tell me about the process. Now, we did this actually under local, which I usually don't do, but you don't like general, so I usually don't do things under local, but you were awesome.
Well, and you were too, and your assistants, your fellows that were there, they were so helpful, and we made it work. And I had a previous ear surgery just not very long before that, so I just really didn't want general anesthesia. So that's why I asked you if it could be done, and it certainly could, and it worked out fine. It was a little, I will be honest, a little, at the very beginning, the needles hurt with the lidocaine to numb it, but other than that, it was so tolerable.
Yeah, great. In fact, we made a YouTube about it, and it's on my YouTube channel. So just it's under Dr. Rohrich YouTube channel. So yeah, take a look at it. I did it a few months ago, because it's been how many months now? It's been
9
months. Time
and
flies.
the scar is receding each day, and it looks better. I still I have an area. I never was a smoker, Dr. Rohrich, but I have these vertical lines, and
that's a different thing. We can laser that, and we can do lasering. And many times when I'm doing a lip lift, I'm actually doing laser resurfacing as well. And in fact, that's one of the things I did today. And I think those are all things. I think the best thing about a lip lift is that it's a great adjunct in the management of aging, because as we get older, we not only do as our skin sag and we get jowls, but also our earlobes get longer, the lip gets longer, the nose droops, and all those things happen. So if you just do a facelift, there's still some missing links. And one of the key missing links is the lip lift. And the lip lift has become much more popular in the aging patient. And I think just like some other procedures, it's been overdone, like the buccal fat removal, because now I see lip lifts being done in 20-year-olds, which is totally ridiculous. And I saw a patient recently that had a lip lift, and she was 25, and she had huge lips from fillers, and that was it's terrible. And the other thing about lip lifts is that it's hard to fix them if they're overdone, because you can't really put it back.
Right.
So it's really important. In fact, if anything, you want to underdo it a little bit. So I think that's
and that was one thing that made me feel safe and secure about this, because you measured it. We talked about it before. I mean, months before it was done. So I felt comfortable about us taking the right amount of skin underneath the nose and not too much.
Right. Exactly. And then, you've seen examples of it. You've seen patients that have had it.
Right.
And so, I mean, those are very important things, because it is a scar, and we make scars, put them in places that are hard to see, but everybody has an incision and a scar. And I think, we're not God. We're just plastic surgeons, but we hide scars. So that's good. So what advice would you give to women that are considering having this, that are in their 40s and 50s and want to do it either with or without a facelift?
Right. I would say come and visit with you, or if you're not in the state of Texas and you can't get here easily, we'll find someone, do your research, and find a plastic surgeon that does rhinoplasties as well, because it's just so important about not making you have a freaky nose. I kind of have a little pig nose anyway, and so I certainly wouldn't have wanted you to make that any more prominent.
Yeah.
So,
well, I think it's good advice. I think find a board-certified plastic surgeon that actually does, and understands facial aging.
Yes.
Does facelift, does rhinoplasties, and obviously can pay attention to details, especially in those relaxed skin tension lines and where you can hide the scar as much as you can. And I think that's a very important thing.
Yes.
And I think it can be done usually as an adjunct. I usually do it as an adjunct, most commonly with a facelift. And you look absolutely, amazing. So we did that as an isolated procedure, but usually I do it with a facelift and eyes, and sometimes hand augmentation with fat. But that's usually the usual combination. So it's a very common adjunct, and it's like icing to the cake. Not only is it the missing link, but it really helps to make your facelift look so much better, so much softer, because you can have that nice soft filling. And so many times people mistake the correction of the aging long lip and they add fillers, and then people look weird. They look like ducks. That aren't in the water, and
Right.
it's not a good look.
Well,
So
and I've had that too, Doctor, not by you, but that's what I started with, fillers. And instead of
Right.
it making that length, your philtrum, which that space is called, shorter, it really didn't. It almost made it look longer
It
with
flipped.
fat lips.
Right,
And so I
exactly.
quit doing that, and that's why I started looking for you. I wanted a more permanent solution
Yeah.
to my issue.
Yeah, no, that's a great point. And I think the other thing about it is that, really, it's really fairly minimal discomfort after surgery.
Oh,
you
very
tell
much.
me.
I didn't
right?
have any pain pills, didn't need them. I just took care of myself, followed,
Yeah,
your
it's-
orders, after care.
Yeah.
So it did not, it's not a painful thing to get
Right.
over. It's just the
Right, and the
healing
stitches come out.
process.
Right, and the stitches come on about 7 to 10 days.
Right.
And you can be back doing most everything and eating that same day. So it's really a fairly easy recovery for you. I mean,
Right.
it requires finesse. We mark it. And again, you can see the YouTube where we actually recorded it all, and it really shows exactly how we precisely marked the central and upper lip and showed it. And then we looked at, what her tooth lip show would be like, and you can see she looks, absolutely beautiful. And we'll show her photos again just to give you an idea of that. And again, it's a great adjunct for facial rejuvenation. And many times I'll do that, and then if you're doing it in the office, you can do fillers and Botox and neuromodulators with it as well. And I think that's a really good thing. So what's next for you? I mean, you look absolutely awesome. I know you're living in Colorado.
Yes.
So
Well, I'm currently, because cannabis is legal in Colorado, I am currently making some anti-aging products.
Skincare products, or?
Yes. I infuse some hemp seed oil, and I use different botanicals, whatever your kind of issue is, and I infuse it with CBD and a little something else
Okay.
that's not legal in Texas. So we'll leave it at that.
yeah, we'll leave it at that. So no, it's great. Well, it's great. And I mean, you're natural beautifully anyway. But so what? I'm sorry. What?
Well, I wanted to say the thing that I appreciate about you when I was working for you, I heard you sometimes. A woman would come in, maybe almost 70, and say, I want Botox and filler. And you would be truthful and say, we can do a little bit extra for you. However, so I guess my question was always, what's the best time for a facelift? I know I want to do one at some point with you, but I'm just not ready yet. I think I don't actually. You helped me with the jowl area. You put some Botox in, and the platysmal bands, which sometimes you get old lady neck. Men have it too, actually,
right.
don't they? Yeah. Aging neck.
Yeah.
So, I mean, what's the best
time?
age?
Well, it's a very good question, Jana. And I think, you obviously have really taken good care of yourself. And I think that means, no smoking, staying fit, using good sunscreen, and all those things. The best time to get a facelift is when you think you need it, especially if you have jowling. If you have jowling here and you have platysmal bands, that's when you should have a facelift. And so many people continue to put fillers in, and then you look like, the Stay Puft Marshmallow.
Right.
And that doesn't look good. So once you start getting jowls and neck bands and things, that's when you need to get a facelift. But you're totally fine. And we did it non-surgically, and you
Right.
look absolutely amazing, because we did that a week ago. Yeah. Was it? Yeah.
Right. Well,
Yeah.
maybe 2 weeks.
2 weeks ago,
Yes.
yeah. And so we did jawline contouring, and we did your Botox and stuff. And so there's a lot of finesse things you can do today non-surgically, because most people don't want surgery until they absolutely really would maximally benefit from
Right.
it. So that's the great thing about plastic surgery today, because a really good plastic surgeon can do everything from minimal to non-invasive to the invasive things. And I think that's the beauty of who and what we are as plastic surgeons, because I can look at somebody and I can say, hey, they'll come in and they want something. I say, I don't think you should have that. I mean, there'll be people say, we want to do that because they want to financially be rewarded, but I don't like that. I want people to look good and be happy, and I give them my advice based upon my experience of almost 30 years of saying, hey, this is what would look best on you.
Right.
It's not a facelift. It's probably fillers, or if you have jowls, it's, let's consider doing a facelift or a neck lift. And I think that's the advice that I think people should have, because so many times I see people that have had things done that should have never had them done, and they look different, they look weird. And, we're in the face protection business, not in the, witness protection business in plastic surgery. And I think that's really something that people tend to forget.
Right.
So know before you go, find somebody, a board-certified plastic surgeon or a facial plastic surgeon that really cares about their art and about their skill and can deliver great results. Look at their website, look at their Instagram, look at the photos they show and the videos to see if they truly do look normal and natural, not look weird. Because if you want to look weird, I can send you there. But this is not the place to go if you want to look weird.
Well, and that's why I chose you, because I saw your before and afters, and I actually talked to some former patients of yours that were lifetime patients, and I wanted the natural look. I want to look in the mirror and feel good about myself at my age, and I actually most days do. I mean, some, I don't, but I just want to look just a little more youthful and age gracefully. And some women don't believe in anything. They just say, oh, poppycock for that plastic surgery and all that. And I said, well, I've never had any, but I do have a little help along the way. And I think it's just fine. If you feel better about yourself and you feel more confident.
Right, absolutely. It's all about that. Everybody has inner beauty, and you want to portray that both in many ways, either with external help or internal help. It's fine. I mean, that's what we do, and we're here as plastic surgeons. We're here to give you good, prudent, and safe advice so that you can look the best you can be, and you can be the best you can be. And I think that's what a good plastic surgeon does. So Jana, I really want to thank you for taking the time to come all the way from Colorado to visit us in Dallas, Texas.
Dallas, Texas, and thank you for having me, because you're my favorite doctor. You are, and you always will be, and I appreciate what you do to help me look a little more youthful.
More youthful. And beautiful. So, Jana, thank you so much. It's always a pleasure having you and seeing you in Big D, and happy holidays.
And
we'll look
you
forward
as
to
well.
seeing you.
Yes.
All right.
All right.
Right.